The innocent sound of children's voices cannot conceal the deadly serious message. Kids here must face facts early as the life expectancy in some parts of southern Africa drops below 40 years of age because of AIDS. These children, an important part of the workforce of tomorrow, are only too aware. After all, it was AIDS that took their parents away. And now they spend their afternoons in this orphan care program in rural Botswana, known as Dula Sentle.
Sometimes the children would just come to the gate and say, "Yeah, I am. My mother just passed away last week."
This 17-year-old girl came to Dula Sentle 4 years ago.
And I think it makes me feel proud of who I am. That's how I changed.
There are 12 million AIDS orphans in sub-Saharan Africa, as the AIDS virus kills the most productive sector of society, people 15 to 49 years old. It poses a business risk and a threat to sustainable development. By 2010, AIDS is expected to shave 20 years or more off the life expectancy in several southern African countries. The impact of AIDS is a loss of skilled labor, reduced productivity, increased absenteeism, and a precarious economic base. A huge challenge for the resource-strapped public sector, which needs to ensure a healthy labor force today and make sure these orphan children grow up to be productive citizens. That's why the private sector and privately funded groups like Dula Sentle are crucial to the region-wide struggle against the epidemic.
We know very well that as government, we can't do everything. In development, everybody is a partner.
So what can the private sector and the people of southern Africa do to fight this disease? Swaziland has the highest HIV infection rate in the world. Gone Rural, a small Swazi company that has recruited the women of this village to weave the handicrafts that it sells around the world, has its own HIV/AIDS employee education program. And when the Swazi government postponed World AIDS Day celebrations in 2005 in favor of the start of a sacred national festival, Gone Rural held its own ceremony.
Today is World AIDS Day. We don't do enough talking and we don't do enough thinking about HIV and AIDS.
It might be a small company in a small country with little public sector support, but the private sector has provided a lifeline to areas devastated by AIDS. Here, an entire generation has disappeared. Young adults who would normally be working for a living have died. This work is the women's only source of income.
And most of them have got at least 8 dependents, 4 of which are not theirs. They're their children's children that have died.
There may be signs everywhere, but many say AIDS fatigue is at an all-time high. That people in Swaziland and throughout southern Africa don't really want to talk about the disease.
And if you read in the newspaper, the obituary section, there are so many people dying and they'll write, some unknown illness or TB or whatever, but nobody ever really says that person died of HIV and AIDS because of the stigma attached to it.
We need to address as a country a number of the social structures that exist in this country that generally lead to AIDS not being seen and identified as a killer disease.
It's a challenge for Swazi companies and labor unions alike. Procan Managing Director Robert Maxwell has seen a direct hit to his productivity from AIDS, and he's helped launch a business coalition against the epidemic in Swaziland.
Start to see workers slowing down, productivity decreases, workers drop off, they drop dead every month. They'll come to work on a Wednesday, they won't come on a Thursday, and Saturday we'll get the message that they passed away on a Friday.
So Maxwell wants to set up a clinic right here at the Procan factory.
Why take 800 workers to go visit one doctor when you can bring the one doctor to 800 workers?
But it's been hard to convince the unions of the merits of a company-run clinic. They say employees are afraid they'll lose their jobs once management finds out they are HIV positive.
But if you ask them to test, they won't go. They won't go for the test. Not here. So basically what we're trying to have is a center which will be their center, away from the workplace, away from, prying eyes, but then they should feel like they are going to a union clinic, basically. That's where they will do their own things.
As workers, we are still struggling after all these years, there is no absolutely program for workers. This is why we think if we can start to do things on our own, at least something may come up, because the government is helping nothing with regard to this issue.
The companies, the private companies that are taking that initiative and funding such things as an HIV program are the huge conglomerates like Coca-Cola, Cadbury's, Swazi Paper Mills, companies that can easily afford proper treatment now and continuous treatment for the future for their workers.
So how does Swazican manage to provide free primary health care and HIV/AIDS counseling at its clinic? The medium-sized agri-processing company even makes arrangements with outside clinics to treat its employees for the disease. First, it recruited Job Mpele and acquired his corporate AIDS policy experience at Coca-Cola. And it worked with the Workers' Union, who openly welcomed the company's approach to treating HIV.
Mistrust being put aside, because you have senior representatives of labor being able to come in and encouraging people to disclose their status. We also clearly state that the company will not discriminate based on a person's HIV status.
In contrast to Swaziland, Botswana's public sector is able to provide AIDS antiretrovirals to its population.
We've just surpassed the target that we had set for ourselves. I think we are doing very well, and I think it's because a lot of people are now coming for testing.
So how can the private sector here take advantage of its government's AIDS policy? Diamond firm Debswana was one of the first companies in the world to provide a comprehensive HIV/AIDS program to its employees, including treatment. This parastatal runs hospitals close to its mining operations in partnership with the Botswana government, which also serve residents of the local communities.
We have seen death rates significantly fall since we started the antiretroviral therapy program. We have seen time lost due to illness dramatically fall. We have seen ill health retirements dramatically fall.
But what about smaller companies that say they can't afford Debswana's AIDS program?
The cost of not doing anything, I think, enough to actually wipe out the business.
We're not saying they must spend any money on these programs. We're saying the public sector is offering these programs. Now make an initiative and go and get these programs to your people.
That's what the Botswana Business Coalition on AIDS does, by helping companies access what the public sector already provides to citizens. It conducts business seminars and hands out awards to companies who engage in best practices. In the case of Botswana, it's all part of a concerted national effort to eradicate HIV/AIDS by 2016.
It's because of the government supporting the NGOs that are dealing with HIV and AIDS. And then the most important, again, is the people living with HIV and AIDS who stood up really to fight HIV in Botswana.
That kind of government initiative is proving crucial to waging war against AIDS in the workplace. The tiny nation of Lesotho has a fraction of the resources of Botswana, but it has a national plan to encourage every citizen to be tested for HIV by 2007. The government will also partner with the apparel industry on a new initiative to prevent and treat AIDS in clothing factories across the country. In countries like Malawi and Mozambique, the private sector has organized itself in its fight against AIDS. The Malawi Business Coalition Against AIDS has grown to over 50 companies. At Mozambique's own business coalition, Ecosida, the phone hasn't stopped ringing since the government announced a high-profile initiative. The country's president wants every segment of society to help him find a way to fight the disease.
What should be the role of private sector in putting effective programs, HIV programs in the workplace? I looked at really as a strong tool to advocate at all levels, especially in the communities where today we argue and we say that the response is not there.
Ecosida has also launched a pilot project for 60 companies to help them initiate HIV/AIDS programs. One of those companies was the container terminal for the Port of Maputo.
We did a few months ago a testing campaign here in our terminal. So we had a very high percentage of attendance, people that came for testing. and the company helps whoever decides to declare that they are HIV infected. The company can pay with the medicine and consultation.
There's a pressing need for innovative private sector response to AIDS in this country. Mozambique's infection rate has continued to climb since the end of the civil war in 1992.
We say trucking routes are AIDS routes.
And this has been the main avenue of infection into Mozambique as the country rebuilds and opens itself up to trade. It's said there's a 50% HIV prevalence rate among the region's 72,000 truck drivers.
If you have a slow border and drivers have to sleep over, it encourages HIV/AIDS, because once the drivers know that they are stopping over and they know that they can now play around, they also set up their businesses there. Others set up businesses to suit the drivers. The quicker we get through the border, the less problem we have with the HIV/AIDS.
But until Southern Africa installs 24-hour border crossings, this place may be one of the best ways to combat the march of AIDS along trading corridors. The Komatipoort Wellness Center is the result of a public-private partnership which includes the South African Department of Health. It sits right on the border between South Africa and Mozambique at a commercial customs clearance depot. Ikaheng HR Services conceived the center in response to a request from South Africa's Road Freight Association. Ikaheng runs 11 such wellness centers strategically positioned on South Africa's major commercial routes.
We're currently at this stage now probably looking after about 80% of the country.
It helps that the centers don't focus entirely on HIV/AIDS. Nurses provide general health checkups and later an HIV test if a driver requests it. Peer educators also discuss sexually transmitted disease prevention and then slowly ease into the topic of AIDS. The wellness centers have proven to be such a success that the drivers' employers now want Ikaheng to treat their office staff as well, so they introduced the mobile clinic. It parks outside a company's premises for as long as it takes to test employees for HIV. Mobile clinics operated by third-party organizations have helped erase the stigma some employees feel about testing for HIV in the workplace. Leadership from the highest levels of government also helps. But some say role models are needed most to engage the region in a frank, open dialogue about AIDS. Musician Stuart Sukuma is a household name in Mozambique. He recently toured the country with an AIDS awareness message for his young fans.
Every chance that I have, that I'm on the stage and I have a lot of people listen to me, I mean, I can take like a few minutes to talk about it. My message is, if you want to be something in the future, in the near future, you have to fight for it. And fighting for it is to fight to be alive, you know, to reach, you know, and to get to the point that you where your dreams are.
In Botswana, this HIV-positive couple decided to speak out against AIDS.
Once they realize they are positive, they like go out and give up and, you know, lose faith in that they can still live the second day. But we have decided to come out as a couple to model, you know, the kind of behaviors people should live.
At Dula Sentley Orphan Daycare, the simple solution is one of self-reliance. The kids acquire skills that they can apply when they become adults. Even the furniture they learn to build is sold in the organization's gift shop. That helps finance Dula Sentley's operations, keeping it entirely independent of the public sector. And it keeps the kids in the community, with their friends and extended family. In this fight against AIDS, business and the next generation of employees and entrepreneurs need every advantage they can find.
I want to see them being the leaders of this country. I want to see them growing up as healthy children.
I think I'll be working in an office or in a restaurant, somewhere that will keep me busy and that will make me strong and myself proud of what I've been doing.